LifeBio solutions have led to statistically significant decrease in loneliness for lonely individuals at baseline. And these are fairly good size populations that have been studied, an N of 250. We had a 15% reduction in depressive symptoms. Efficiency and effectiveness of care staff improved in Alzheimer's and memory care. Mayo Clinic reports people have better mood as a result of using LifeBio. My name is Beth Sanders. I'm the co-founder and CEO of LifeBio, and we deliver age tech solutions powered by AI for better health. The company is actually inspired by me recording my own grandmother's life story, and it's something that she could do, and it's something she loved to do, and she shared her memories and experiences with me, and it brought us closer together and inspired my life. It was a personal, powerful story, and that experience plus hundreds of experiences like that in the field with older adults has led LifeBio to address three big issues facing older adults today. And those are loneliness and social isolation, depression, and Alzheimer's or other forms of dementia. And probably everybody listening on this presentation can think of an older adult in their life facing one of these problems on the screen here. And, one thing can kind of lead to another too. So loneliness and social isolation leads to higher rates of depression, higher rates of Alzheimer's disease, poor heart health, poor diabetes management. And $200 billion is spent annually by Medicare, for example, on these issues impacting older adults in the US alone. So it's a big, expensive problem. And loneliness, health plans see loneliness as $3,100 to $3,800 per patient per year as a cost to them. And so they're interested in solutions to solve for that. So we also have an increasingly older population. So 54 million are 65 and older, moving to 72 million and 82 million. I think we all know it's a growing market, and that's why we're addressing the aging, healthy aging, and Alzheimer's moonshot. We're really proud of the research behind our work. LifeBio solutions have led to statistically significant decrease in loneliness for lonely individuals at baseline. And these are fairly good size populations that have been studied, an N of 250. We had a 15% reduction in depressive symptoms. Efficiency and effectiveness of care staff improved in Alzheimer's and memory care. Mayo Clinic reports people have better mood as a result of using LifeBio. And right now we have a 200-person, 10-site clinical trial underway and 2 more loneliness studies coming. So we realize that we have to have an evidence-informed solution. We have to be completely HIPAA compliant when we're working in these settings across the healthcare spectrum. So serving from health plans to health systems, hospice, home care, and even senior living. So we've kind of crossed across the health system because basically everybody has a story to tell, and we all need to be addressing these problems facing older adults. So right now you'll see some of our software solutions to this. So again, we have an age tech suite basically going on here. So LifeBio Memory is a life story app that is capturing people's voices and saving that for a lifetime for them and their family. And so we see a future of absolute intense personalized engagement. If we know people better, we can deliver better care, and we can provide summaries of who they are through AI. So AI is behind the scenes here. As we pose questions, it's processing the answers. It's building BI reporting for the healthcare settings so they know who these patients, residents, or clients are in their care. And of course, we're getting a powerful legacy from that too. And we know we're supporting family caregivers who only want the best care for their loved one. Next, we've developed My Hello, and this grew out of the pandemic. In fact, launched right at the beginning of the pandemic. We're matching peer-to-peer or My Hello guides to older adults for life story conversations. And we use any phone because, believe it or not, 37% of people over 75 do not even have any mobile phone, not just a smartphone, no mobile phone. So I guess you can think of it as Match.com for 80-year-olds who need a platonic friendship at this point. They may not get out a lot. If they don't see their mail lady, they don't talk to anybody all day long. That's who we are reaching out to on behalf of health plans who are our clients. They can have that phone ring at the same time each week. And again, it's a friendship model of care. And of course, people all have a story to tell. And we're just tapping into that story as they're also reducing each other's loneliness. We know with COVID that loneliness and social isolation are a real problem, and in-home solutions matter and can work. So this is, again, particularly interesting to large health plans for our clients. And then the third piece of our HCheck suite is a 10-minute screening app for mild cognitive impairment. It grew out of an NIA Small Business Innovation Research Grant. And again, with our work with dementia already, it was a good logical solution to make it easier for people to be screened. We know out there there's a lack of people being screened. So making that easier and with our partners at Brown University, testing has been an exciting project for us to roll out to. So we're building this HCheck suite of software. We've got a great team of app developers, .NET programmers, AI data scientists all working together. So a very efficient team and continuous improvement. We expect 2.2 million in revenue this year, 5 million in 2023. We're building out our sales team already, but we want to continue to grow that and reach 27 million by 2026. And although we've had angel investment and we've been able to do an SBIR grant actually too, we're raising our first institutional funding, and 3 million is needed now. We're shooting for January 2023 for close. And so it'll be sales, marketing, systems, scalability, just continuing to add some key hires for us to continue growing. And so we would love to connect with you if you would like to know more about investing in this incredible company, LifeBio, who is changing the lives of many older adults in this country and around the world as we go forward. And so please be in touch. And also, if you know of a provider, payer who would be interested in this kind of solution, send them our way. Thank you.
Awesome, Beth. You've really grown so much over the years, and congratulations, traction. This is new content for people. So can you explain how using a life story can actually improve the quality of care that's delivered?
Yeah, when you know who people are, you can customize, personalized care. I just think there'll be, as the healthcare system continues forward, we're going to get very specific about what people need because of who they are. We're actually going to know who this person is in a healthcare setting. And in some cases, somebody's being, served in a senior living community or in other settings for years, even in a health plan or in a health system. So we think that they're more than just their physical health problems. And this is an intervention for mental health. So we're asking, people are being asked life story questions using an easy recording. They're now just, their voice is being recorded and a voice is going to the cloud and you're able to access that. And then AI is processing it so that it's accessible for ongoing care because you'll know who they are.
There's a question about your product in the Q&A, and I know you're working with some very large insurance companies. What are primary products, right? Kind of explain the traction there.
Yeah, so the life story piece of what we do, which is an app, which is typically family member, staff member, someone face-to-face with someone recording. That's the life story piece called LifeBio Memory. And then My Hello is the loneliness intervention. And those two are out there in the market. And LifeBio Brain is just experimental at this point, but we'll probably by next year being able to market that to some of these same providers who also need to know, is this person facing a cognitive issue and should we be addressing it?